9 new cases have been recorded in the Northern Territory of COVID-19, all Indigenous people and household contacts of the 2 cases confirmed yesterday. Live to Matt Cunningham in Darwin. Matt, explain to us what we're seeing here and how concerned are authorities in the top end about it?
Well, they're extremely concerned. I think dire was the word that the Chief Health Officer used about the situation that we're now facing here, Kieran, in many ways the worst nightmare of the Northern Territory government, and that is an outbreak that is affecting the Northern Territory's Indigenous population. We now have 11 cases, all Aboriginal, linked to what's being described as the second phase of this KATHERINE cluster. There was a minor outbreak in the Greater Darwin and KATHERINE regions about 12 days ago. Authorities thought they had that under control, although there was some concern that there was still positive results showing up in the KATHERINE wastewater testing. We can probably see why that was the case now. Another 9 new cases today after 2 more were reported last night. Here's the Chief Minister giving a rundown of exactly who those cases are.
All of the new cases are Aboriginal Territorians. A 71-year-old man, a 65-year-old woman who has been admitted to Royal Darwin Hospital, a 62-year-old woman, a 40-year-old woman, a 38-year-old woman, a 22-year-old woman, a 16-year-old girl, 2 5-year-old girls, twins.
We're going to see here, Kieran, a real test, not just of the Northern Territory government's ability to test and vaccinate residents, but also of our hospital system to hold up. We know that those people who have tested positive in KATHERINE have been moved here to Darwin. Most of them are at the Howard Springs quarantine facility. One woman, a 65-year-old woman, is at the Royal Darwin Hospital. But there has been a plea from authorities to really lift the vaccination rate. We know the vaccination rate in some remote Indigenous communities has been extremely low. The Acting Chief Health Officer, Charles Payne, really making a desperate plea to people now that the virus is here to go out and get vaccinated as soon as they can.
If you're still waiting to get vaccinated, you could be exposed to the virus at any time. You're taking that risk of being exposed to the virus unvaccinated. And the consequences of that, particularly for the communities in the Territory, could be dire.
So we now know that 10 of those cases were in KATHERINE. There was another woman, a 30-year-old Aboriginal woman, who had been in those 2 houses in KATHERINE where the positive cases had been recorded, Kieran, but she subsequently travelled to the community of Robertson River. That's a small community of about 350 people near the Queensland border. It was an interesting twist this morning when Malarndirri McCarthy, the Labor senator, actually revealed that this woman was her sister.
I'd like to say a personal message, and that is that to my sister, who is the source of the COVID infection in Robinson River, that our thoughts and prayers are with her and our family.
So authorities now desperately trying to get in touch with the close contacts of these 11 people who have tested positive. Kieran, one of the main concerns are the exposure sites in KATHERINE, in particular the KATHERINE Hotel. It's been listed as an exposure site between noon and 4:30 p.m. last Wednesday and between 10 a.m. and 6 p.m. last Friday. There are concerns that people may have contracted coronavirus there and taken it to various places, possibly to other remote Indigenous communities. This is very much a watch and wait situation here in the Northern Territory. The Chief Minister unable to rule out that we could see potentially dozens more cases in the coming days.
We will stay in touch, Matt, on that concerning situation. Appreciate it.